Well, we spoke with registered nurses from St. Paul's Hospital yesterday, and they shared with us that this is the worst they've ever seen it. They've never had anything like this where they've actually had petitions put in the waiting room. They're very concerned. It's the number one concern for them is patient safety. The fact of the matter is there are no proper hookups. There's no oxygen. There is no call bells. It's wide open in front of windows. There's no privacy. Imagine if your loved one comes in there with a heart attack and has to be treated in the waiting room. And when we hear too that the triage nurse is having, up towards 40 patients alone that they have to manage. And I said, oh my gosh, like what is happening here? So what's happening is that people are being pulled away from emergency because now they've opened up. They're trying to open up the day surgery and push people over there so that they don't have beds in the hallways and those types of things. So that pulls registered nurses out of emergency, and they have to go over to the day surgery to try to help out. So again, we are putting the patients that are coming into St. Paul's Hospital into a very dangerous situation. There doesn't seem to be any break in the action. And then when we think about it, we have to actually think about it, not just ER on an island by itself, because that emergency room affects the entire system. The entire hospital is affected by what's coming in. So now we know this morning, and this is very fluid. So by the time I'm talking with you here right now, this number could be even higher. So that means that there's going to be pressure on the hospitalists to think about who they can discharge. And our people then get discharged before they should, to try to get rid of this flow that's stuck in the emergency room. So these people go home who are not ready yet to be home. And we also know that our community is also in the same kind of dire straits pressure that we're seeing in the emergency rooms. So our home care and our public health, our community health, community mental health is also very short-staffed. COVID is ravaging them as well. So how quickly they're going to be able to go and check in on these people who are being discharged to home. They may not get to see anybody at all. So their acute illness that they went into hospital with that might have settled down a little bit, but not as much as it should. Now they're back home, and that acute illness is only going to rise up again and make them ill. They have to call 911, and there they are back at the emergency room. So we've solved no problems whatsoever here. All we're doing is stacking misery on top of misery.
You referenced one nurse to upwards of 40 patients. What's a normal nurse to patient ratio?
Well, for the charge nurse, it's 7 to 10, wow. which on a normal day is, you know what? I don't think there has been a normal day. I need to take that back. We don't even know what normal is anymore, because it's like all caution has been thrown to the wind. There is no regard to what's happening here. When we have a health minister who says that the system is stable, I'm not sure what system he's talking about, because it's not the system in Saskatchewan. Because if St. Paul's Hospital in Saskatoon is having this kind of issue, without a doubt, the same thing is happening at Royal University Hospital, and the same thing is happening at City Hospital, and communities under pressure like never before. And then all we have to do is think about what's happening in Regina and Yorkton and Prince Albert and Swift Current, and it goes on and on.
Tracy, thank you so much for your time.
You're welcome.